It's the work that the people that I've never met, that have done what they have done, that have provided me this opportunity to be alive, to be healthy, that now I want to do something to push that envelope forward, and be a better human being because someone was a better human being for me. My name is Grishma. I am an artist and a doctoral student, hoping to finish up my training to be an entertainment psychologist. And I'm also a cancer survivor. My health journey started at the age of 16. I got the diagnosis of the desmoid tumor. We went through surgery, we went through radiation, we went through chemotherapy. So when we found out that there was a reoccurrence, that's when we realized that an amputation was necessary. And then there was another reoccurrence, and the tumor was located in an area where surgery was not ideal. And we started that process of intravenous chemotherapy again. My oncologist at the time said to me, you know, there's this clinical trial and you might be a really good fit for it. And my family, we discussed what the possibilities might be. And there was also the thing about hope. We were very hopeful and we decided to participate.
Like Grishma, right? So she is the prime example of what it means to participate in a clinical trial in a community setting, right? She was able to continue with her very busy life, participating in a clinical trial that allowed us to expose her to a drug therapy that was completely novel at the time when she went through this treatment and had a fabulous outcome as a consequence of it. And now that treatment is now standard of care. So no matter where anybody with her diagnosis now presents to a medical oncologist, they will have the benefit of being exposed to this treatment and hopefully duplicating her fantastic outcome.
Advocate has 12 hospitals, over 350 sites of care, and really the Advocate Research Institute provides the infrastructure and support for investigators across that entire footprint, from research with children to adults. We have the Center for Pediatric Research, for example, that is focused on caring for children and finding best ways to care for children through research. And in the adult arena, we are doing a lot of research in oncology, in cardiovascular health and heart disease, as well as in the neurosciences. It involves a whole host of disciplines, looking at how we find better ways to transform care across the organization. And it's really that team science that we also support as the Research Institute. So we have scientists, epidemiologists, biostatisticians that work with our clinical thought leaders to say, how do we provide better care to our patients? And how do we use that information to translate to better outcomes?
One of the things as just a cancer patient in general is the amount of support that you have. I have been blessed by many, many people. People often ask, what has been your longest relationship with someone? And I laughingly say it's been with my oncologist, Dr. Pamela Kaiser. It's been 16 years. So as an artist, one of the things that I do is create paintings. The painting that really touches my heart is about this young girl. She's wearing beautiful ethnic clothing and her eyes are closed because she's dreaming. And she's dreaming about the adventures that she's going to have. When people look at that one painting, I want them to ask themselves, are we dreaming as big of a dream for her as she is for herself?